Hospitals are focusing on people who are over 80 and some health staff. Well, our health correspondent Anna Collinson is at St George's Hospital in London for us this morning. Anna, what are they expecting there today?
Yeah, good morning. Welcome from St George's Hospital in South London. And as you say, the second day of the vaccine rollout is happening. So, Angela, you work in a care home nearby.
That's correct.
Talk me through what this moment means and the year you've been through.
Yes, it has been a really hard, really restrictive year for residents and staff.
Well, our health correspondent Anna Collinson is here. So, Anna, cases and deaths continuing to fall. How much confidence is there that that trend continues as restrictions ease?
Yeah, well, as we try to edge closer to normality by easing restrictions, infections are expected to rise. So, to protect the NHS, the government has put criteria in place, so a certain level has to be met before we can move on to the next stage. The first big test was the reopening of schools a month ago. And this week, government scientific advisors said there was nothing to suggest in the data that we can't now move to step 2, which is the reopening of non-essential shops and beer gardens. But some scientists say it is too soon. They're particularly concerned about some virus hotspots, particularly in parts of East Midlands and also in parts of Yorkshire. But the government would argue the UK is in a very strong position with more than 40 million, nearly 40 million vaccinations now administered. Now, tomorrow's easing is not viewed as particularly risky as long as people stick to the rules. But what's more of a concern is the possible easing of allowing indoor mixing and foreign travel next month. The fear is if things move too quickly, there could be a third wave.
Is the vaccine going to be compulsory, and what are the potential side effects?
It's a really good question. No vaccines in the UK are compulsory, and it's the same for COVID-19. The reason being, experts say making it compulsory can really damage confidence. But the Prime Minister, Boris Johnson, is urging people to take up the vaccine, particularly those in the most at-risk groups. As for side effects, data from the Pfizer trials say they're mostly very mild. Of course, no medication is 100% risk-free. If millions are immunised, we're going to see potential side effects appearing. But the hope is that they're going to be monitored very closely and patients will report any problems they have along the way. A group of more than 80 medical researchers from across the globe are working around the clock to try to produce a vaccine in a matter of months, and they've really got their work cut out for them. I'm just going to run through a few of the things that they've got to get through. They've got to create a vaccine that is not only safe, but that works. They've then got to work out a way that they can scale up that vaccine and get it produced on a mass scale. Regulators have to approve it. And then finally, just one little task of being able to inoculate the majority of the world's population. Now, scientists have sort of agreed that they expect there to be a vaccine in mid-2021. If that's achieved, that would be a huge scientific achievement. But yet we don't know if there's any guarantees that that vaccine will work.
Now, there will be some people watching right now who are thinking, why aren't we hearing from the NHS this morning or others in authority who can talk about this? And perhaps our coverage seems one-sided. What do you say?
I'd say that would seem fair, and I would understand why people would potentially think that. What I would say is I've been trying with my colleague Jess since October to try and get the relevant health bodies to come on our programme, to sit down in front of a camera so we can go through our findings, or to come on the programme today. We actually pushed back the date of this programme by a week because of the election to give them a bit more time so they could come on, but unfortunately no one was available.
I mean, so many people picking up on this.
Yeah,
why?
I mean, who outside the UK knew what a WAG was yesterday? I'd love to know. But Rebecca Vardy and Colleen Rooney, for those who don't know what a WAG is, that's a term referred to a girlfriend or a wife of a sports player, normally a footballer, and there's sort of an idea of they're glamorous, they're beautiful, and they create and are involved in drama. That's sort of the stereotype. We've been inundated with tweets, with memes, people calling this the story everyone needs, particularly in the UK where we've got Brexit dominating. It's been a real light relief for a lot of people calling it War of the Wags. This morning, the traffic was at a standstill and there were police cordons and police vans all around the hostel. And lots of people were taking a moment to look at a building that until today they'd never even noticed. It was just another building until today, but today they've realised that that is the place that's believed that the attacker was staying. I did speak to 2 young women who were aware of the hostel. They said they'd grown up in the area and had said as children their parents had warned them about the hostel. They said, be careful about speaking to people who hung out there, they're a bit dodgy. They said that actually nothing bad had ever happened. They'd always felt perfectly safe, but that yesterday afternoon as soon as the attack happened, there was a lot of commotion outside their flat. They looked out the window and they could see the hostel. There were police cars outside and they saw 5 or 6 people being escorted, and there was a helicopter overhead. One of the big highlights was Ariana Grande. I mean, I'm a fan of hers anyway, but the ball gown she was wearing last night was insane, including matching gloves. Now, it's reportedly 20 foot in diameter, and fans were saying before the show had even started that she'd won the night already, that it was all about Ariana. She also did a set of her own hits, but this is what we're probably all going to remember her for.